So the first picture is a sagittal CT. This person doesn't have ankylosing spondylitis, but for some reason, they have an injury that looks like the patients that do. So right under the inferior end plate of T10, you see there's disruption. There's disruption of the end plate. There's disruption anteriorly as well. So that's right under the end plate fracture. When you see something like this, you always know it's going to be a hyperextension, so bending backwards type injury. And again, you know there's disruption of the anterior ligaments complex, or the anterior column. So this is going to be that B type injury. On the MRI, we can see it even better that this is I don't know if this is a stir. I think this is a stir. So you see the bright stuff where there should be no bright stuff on the inferior aspect of that vertebral body. That's all hemorrhage and fluid and edema. We don't have that ligament. That black line that should be there is gone. So the anterior longitudinal ligament is disrupted, broken. Behind there, you have spinal cord. Your spinal cord should have CSF around it, like it does up higher. It should be dark in the middle and bright on each side. But down here, you see the whole thing is gray. So that's a lot of edema within the conus and injury. And down lower, there's a black blob, which is hemorrhage, black there, yeah. Now, posteriorly too, we do have a disruption of the ligamentum flavum also, which, this is an anterior column, but sometimes they can have additional injuries of the posterior ligaments complex as well, like this one did. So very severe injury. That's good for me.
Yeah, this will certainly require surgery, but you can see how this can look a little subtle, right? You can be like, oh, it's like a little chip off of the, anterior portion of the vertebral body. It's probably stable. It looks okay. And then you see on MRI, it looks like tremendously worse. But I can't imagine this patient was neurologically intact with all this cord edema.
Hey everyone, Ryan Rad here from Neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.